So welcome back everyone to the chapter 2 of Certified Personal Trainer, which is your anatomical terms. Now, what do you mean by anatomical terms? Let's understand. There are certain things which we call anatomical terms which you need to jargon. So these are the jargons which you are going to perform as a professional on the floor, creating a program, designing. But let's understand what anatomy is. Anatomy is the dissection of the body. And what anatomical position is? As you can see the image on your screen, this is your anatomical position. Palms facing forward, neck upright, chest upright, feet together, pointing straight, all of these things. So this is the anatomical position which I have just shown. And now we are going to see these jargons, these terms as per the anatomical position. So in the anatomy, the first jargon, the first term which comes in front of us is flexion. As you can see, flexion. What do you mean by flexion? Flexion is a movement which is being performed in the front, that is a front movement, or you can say the angle between two bones decrease. All of these movements are happening in the joints. So let's understand flexion first. So here is my arm. I have an elbow joint. I have one bone here and a one bone here. And the angle between these two starts decreasing from here. So I have started the flexion movement which is happening in my elbow joint. And as soon as I finished my flexion movement, the opposite of it, which is the second movement, extension starts. The angle between two bones increases. So angle between two bones decreases, that means the joint is performing flexion, and the angle between two bones increases, that means the joint is performing extension. The same way the flexion is being performed by the shoulder joint. If I am standing here, my hands will move forward, this is flexion. And from here coming back, this is extension. My neck will do flexion and extension. My back will do flexion and extension. My hip will do flexion and extension. The same way knee will perform flexion backwards and extension forward. So this is your flexion and extension. Now if we move on to another term which is your adduction and abduction, that is your adduction. Term says adding in between. Adduction and abduction. What is adduction? So in the anatomical position, we have seen there's a line going from between. Anything which is moving closer to the midline, that is adduction, and anything which is moving away from the midline, that is abduction. Until and unless it is a rotation, we cannot use another jargon which is your medial and lateral. So till the point we are not performing any rotation, that is adduction and abduction, if anything moving towards or away from the midline. How do we do adduction? So if I am standing, my shoulder will perform adduction movement. My hand is coming towards the midline, that is adduction, and my hand will go away from the midline, that is abduction. So the raises you perform with the dumbbells are adduction and abduction movements. Apart from the adduction and abduction, there is a movement called rotation. If anything is moving on one axis, that is my neck is doing rotation. My hands will do rotation. So rotation is moving on one axis, either 360 or all the way around. Now what is circumduction? Circumduction is a combination of all these movements where flexion, extension, adduction, abduction and rotation happens all together. So my joint, shoulder joint, will perform a circle, that is circumduction, where flexion, abduction, extension, adduction and rotation from here till here is happening. So all these movements combined make circumduction. Now if I talk about another movement, that is elevation and depression. Elevation is elevating something. So if I am elevating my shoulders, this is elevation, and this is depression. I'll show you from the behind. This is elevation and this is depression. Now we'll move on to another one, which is your pronation and supination. So pronation means anything which is upside down. So my hands, my palms will perform the pronation. This is the pronation of my hands and this is the supination of my hands. So as you consume soup, you drink soup, supination, supination, pronation, supination. Now after this pronation and supination, we have inversion and eversion. So imagine these hands are not hands, these are my feet, and these feet have two portions. One is the down one on which you stand. This is known as the plantar surface. Plantar surface, I'll write it down for you. This is your plantar surface and one is a dorsal. So plantar is this area and dorsal is this area. If I move the plantar area inside, that is your inversion. That is your inversion of the foot. And if I move the plantar surface out, that is your eversion of the foot. And the same way, the hands are doing pronation, supination, your feet also do the pronation and supination. So if my plantar surface is moving in, that is doing supination, and pronation when the plantar surface move out. So inversion, eversion can be termed as pronation and supination as well, but we use inversion of the foot and eversion of the foot when it comes to the feet. And the same way we have plantar and dorsiflexion. The plantar surface moves upward, that is your plantar flexion, the way you do calf raises. And the plantar surface and the dorsal surface moves up. So this is my feet doing calf raise, it's plantar flexion. Doing opposite of that, this is dorsiflexion. Your dorsal surface coming closer to your shin, that is your dorsiflexion. So if you're standing like this, you do this, that is your dorsiflexion. You do this, that is your plantar flexion. Now we talk about medial and lateral rotation. So medial and lateral rotation means anything moving towards the midline in a rotational movement. So if I do this, this is my medial rotation. If I do this, this is my lateral rotation. The same way in this plane, this is your medial rotation and this is your lateral rotation. No wonder if you do this or this, they both can be considered as medial rotation. But if you do this or you do this, that is your lateral rotation, because the joint has just changed the axis or the plane but not changed the movement. So you can still consider it as a medial lateral rotation. Now the last one is retraction and protraction. When you perform any movement which is related to your back, like you perform seated rows, you have to be in a retracting movement. Your shoulder blades should be retracted. It should be retracted. And the protraction means when you move your shoulders like this. This is protraction. This is normal. Shoulder slouching is protraction. So if you do this, this is protraction, retraction, protraction, retraction. So all of these movements are anatomical terms. Now there are certain things which you need to understand as per the area terminology. How you are going to decide what is up and down. In anatomical terms, we have certain words and jargons which you can use for something which is up and down, or closer or far away. So let's talk about the superior and the inferior. So let's move on to the superior and inferior. Superior. In anatomical position, if you can see anything which is closer to the head in terms of your joints, we are talking in terms of your joints, whether it's this, whether it's this, whether it's this. Everything is in terms of your joints. So if you compare superior and inferior, anything which is the closest to your head is superior. Anything which is far away from your head is inferior. So let's understand. If you see the difference between your shoulder and your elbow, your shoulder is superior to your elbow. The same way, the elbow is inferior to your shoulder. So we need to do the comparison in between two joints. Now proximal and distal, the same way, anything which is closer to your trunk is from here till here, this is your trunk. So anything which is closer to your trunk is proximal, and when it's anything which is far away from your trunk is distal. Example, shoulder and wrist. If you talk about shoulder is the closest to your trunk, so it's proximal to your wrist, and wrist is distal to your shoulder. Now, anterior and posterior, anything which is in front is anterior. A means anterior, B. Posterior means P. That means anything which is at your back. So anything which is back is posterior, anything which is in front is anterior. So if I give you an example, my nose is anterior to my ear. My ear is posterior to my nose. Now medial and lateral. Medial is anything which is closer to the midline. Lateral is anything away from the midline. So if I talk about sternum, this bone, chest bone, and my shoulder joint, which is medial? My sternum, my chest bone is medial to my shoulder. My shoulder is lateral to my chest bone. So this is how you are going to define the anatomical terminology in the anatomy and as a fitness professional. So here we are going to complete our chapter 2, lecture 2, which is the anatomical terms. We will move on to the third lecture, which is your planes of motion. So stay tuned and watch the third video for the next lecture. Thank you.